There's never been a time quite like this one in Arizona, and we all have questions.
How fast is the spike here?
And are we doing enough to stop the spread?
Can our hospitals handle it all?
What if I get sick and really need emergency care?
It's hard not to think about our kids, too.
From education to safety, how do we guide them?
And how will our Arizona economy bounce back?
What about all the people already losing their income?
It's times like these when we have to unite.
And that's why, together,
on TV and radio stations all around Arizona, we're talking to our state leaders.
And hosting this community conversation, the Arizona COVID-19 Town Hall.
Health, safety, economy, education. We are hitting on all of it.
And we are taking your questions straight to the state decision makers who can help us beat coronavirus. Thanks for joining us. I'm Carrie Pena.
And I'm Ted Simons. Let's first introduce tonight's special guests here to provide answers and solutions during these uncertain and unprecedented times. Arizona Governor Doug Ducey, Dr. Kara Christ, Director of Arizona's Department of Health Services, Arizona National Guard Major General Michael McGuire, and Arizona Chief Operating Officer Daniel Ruiz.
And you will see that we are making a point to social distance here in the studio, no live audience, and plenty of space between us. Also note, we are offering closed captioning, and we partnered with the Department of Emergency Management to offer ASL interpreters. You can watch the interpretation at facebook.com/AZDEMA. And we've been combing through thousands of your viewer and listener questions, more than 5,000 questions, in fact, which we will be asking throughout the hour.
Let's start with Governor Ducey. Thank you. Good to see you. Thank you for being here. The numbers today, 1,600 cases. We have over 30 fatalities. Maricopa County hit the hardest. We see these numbers on a daily basis, and we look to these numbers for some sort of suggestion as to where we are and where we are going. How do we trust these numbers when so few people are being tested?
So let me first frame up where we are. I want to say thanks to the Arizona Broadcasting Association for giving this opportunity. I want to say thank you to the viewers at home who are staying at home, and by doing that they are slowing the spread of the coronavirus, and for that we're grateful. This has been a very tough month in Arizona, and my heart goes out to everyone who has been affected by this disease, and that's basically everyone, because no one is unaffected in our state. That's why we brought our senior team here, so we can share with everyone what we know and how we're making decisions. We're thinking with our head and we're thinking with our hearts. We're following the numbers and the data, which I'm going to talk about, but we also know that every decision that we make is affecting the people we love most, our parents and grandparents, our neighbors and loved ones. So I want to begin by just saying to everyone, if you don't have COVID-19, we don't want you to contract it, and it's avoidable. And what we talk about tonight will allow you to do that by making good personal decisions. If you do have COVID-19, or you're concerned that you've contracted COVID-19, you are top of mind. We want to make sure that you're going to have all the care and comfort that you need, along with support and information. That's why you're going to hear us talk a lot about supplies. You probably heard about PPE, that's personal professional equipment. That's the gloves and the gowns and the masks and the ventilators and everything that our heroes on the front lines, that's our doctors, our nurses, our emergency medical responders, are going to need so that they can help navigate through this. So a shout out to the Army Corps of Engineers that has parachuted into Arizona and will be able to build additional hospital capacity if that's necessary. And of course, I don't want to forget about our teachers right now. They are at home teaching over a computer, oftentimes removed from the reason that they entered the profession. And that's our kids who are home all day with moms and dads. And we're going to be able to get through this part of it, but to the National Guard who's shoring up our supply chain, and to the people that are working inside the grocery stores, restocking those shelves, because the next month or two in Arizona are going to be tough ones. So what we're going to do tonight is answer the questions that you have, be transparent. We said that we're going to over-communicate as an administration. We've got a plan, we've got a team, and I want to address the testing part of this. Testing is critical. Every morning I start out with, of course, Kara Christ and a briefing on what's happening in health services. But I also get to visit with all the governors across the country. We have the White House video conference call. Everyone is focusing on doing as much testing as possible, making sure we have the real numbers in real time so we can prepare for what's ahead. We know that the virus is here. We know that it's spreading. And the idea is to reduce the spread and lower the curve. And I'm going to let the subject matter expert talk about the efficacy of the testing, but I'm confident that the numbers that we have to date are accurate, and we just need to get more.
Dr. Christ, are you confident, again, when the directive, as far as the toolbox that you referred to earlier, that if people even express and show some mild symptoms, they should not necessarily be tested? How do we work? Everything the governor just said has to be based on data and information. How do we know those kinds of things when people aren't being tested?
So my team and I have been focused on increasing the testing capacity across the state, and we have done that over the last few weeks. As a public health professional, I love data, and I want as much data as I can get. A couple of the tools that we have, we do have commercial labs that are testing. We've tested over 23,000 people in Arizona. So our numbers have increased significantly. And what we're trying to do is to get that farther. But we need to prioritize those tests for our frontline workers, our doctors, our high-risk individuals, and our first responders. So if somebody's just having mild symptoms, very similar to the flu, the treatment doesn't change. And so we would ask them to stay home, not expose our healthcare workers.
But are you including them as presumptive cases to get some kind of idea regarding the spread?
So we know that we're only seeing the tip of the iceberg, but this is how we do surveillance for a number of other diseases, just like flu. So with flu every year, we know that we are catching those that have gotten a positive lab and reported to public health, but we know that there's a lot that don't go to public health.
Governor, let me ask you, Arizona has been criticized for ranking near the bottom for testing. How are we catching up, and how do you respond to that criticism?
Well, first, I would say we need to ramp up our testing, and that's my expectation. We are at over 23,000 tests, so where we were a week ago when some of that was breaking news, we've been able to do more testing. And this is an issue in every state in the country. Like I said, I host a conference call. I just got off it and I was the moderator for governors from around the country. We're going to continue to ramp up the testing. And I talk to a lot of people, and I know that everyone wants a test. But we really have to prioritize these tests. We have to make sure that the people that are on the front line that are going to take care of the folks that contract this disease do not have it themselves. So doctors, nurses, healthcare professionals, those medical responders, the correctional officers that work inside our state prisons. And then it is people that are symptomatic, and the Department of Health Services is setting that criteria. I believe we'll be in a place where eventually everyone that wants a test will be able to get a test. Today we have to prioritize, and even if someone were to test positive today, the diagnosis is the same. To stay home, do not go outside, wash your hands, cover your cough, recover.
Is the issue that we don't have enough tests, or we are not able to process the tests?
The issue is we don't have enough tests. We are able to process the test. Once we are able to acquire more tests, and these are, I have a lot of confidence in our American manufacturing supply chain, we'll be able to conduct more tests.
Governor, was it a mistake to not start testing sooner?
We did start testing sooner. If you remember, Ted, New York got hit first, and they got hit hard. harder than anyone in the nation. And if you see what's going on in New York right now, Louisiana, and some of the other spots, that's where many of the tests have gone. We're at 23,000 tests in Arizona, and we'll continue to add more.
Dr. Chris, but could we have started what we are doing now earlier?
So we were one of the first public health labs to bring testing into our state. So it took a little bit for our commercial labs, which is normally how most people get tested for any type of medical condition, whether it's HIV, those get done by the commercial labs. It took, our commercial labs came on relatively quickly, but with the issues with the supply chain to actually get the nose swabs, that's one of the barriers that we are encountering.
Governor, when you issued the stay-at-home order this week, you resisted that for a bit. What was the tipping point?
Well, every morning we look at where we are in terms of the risk to the state, the spread to the state, the number of counties and people that are affected. I'm not guessing on these decisions. I've been in alignment with the Department of Health Services and the Centers for Disease Control. So Dr. Kara Christ is an infectious disease epidemiologist. She led the state through H1N1, the Ebola outbreak, and the 2016 measles outbreak. We also do the video conference call with Dr. Anthony Fauci of the CDC and Dr. Deborah Birx. So we look to what the guidance is for Arizona. We're in a different position than every state. And my focus every day was to follow the guidance and make the best possible decisions for the state of Arizona, not with regard with what's going on in the news or what else is happening out there. We're going to be acting with a sense of urgency, but following the facts.
Governor, a lot of folks are curious as to why hair salons, nail salons are considered essential services, essential business.
First, let me talk about what we're trying to do here. We're trying to slow the spread of this virus, which is in every state in the country. The best way to do that is to break up large gatherings. Okay, so that's where we began. We started by canceling school. After that, we shut down restaurants and bars and nightclubs. And I want to say, just as a side note, after the show is over, I hope people will order takeout or delivery. After that, gymnasiums and health clubs and movie theaters have all been shut down. Spring training was canceled. There was no March Madness or opening day. There's no professional sports, there's no college sports, there's no high school sports. Right now there are no gatherings where people can meet in large groups. That's the CDC guidance on how to slow the spread. Now, if there are other things we need to do in addition to that to bring clarity, and the businesses you're talking about are not covered inside our executive order. If they're looking for cover under one of the categories, then they're going to have to be able to demonstrate that they can exercise social distancing or some other type of protective measure.
But how does a nail salon or someone who is styling hair or someone working on, how in the world do they keep the recommended social distancing?
Yeah, and what I said is we focus on shutting down as much as we could of these issues to slow that spread. If there's additional guidance that's necessary, because those services are not covered under the order.
Do you understand, though, why people are confused?
I understand completely.
I want to follow up with a few viewer questions. As we mentioned off the top, we do have more than 5,000, so I want to try to move through these as the hour progresses. Allison Jenkins from Tucson asked you directly, Governor, please answer, why are salons, nail shops, and barber shops still considered essential services? It seems like an unnecessary risk for clients and beauticians, and it is not essential. And then one other question, if I could, from Aurelia Bradley in Chandler. Why is the list of essential businesses in Arizona so much larger than many other states? If you could answer both of those viewers.
Sure. So we took the guidance from what we saw as best practices in other states to add to Arizona. And like I said, the businesses that are being mentioned here are not inside the order. What they're taking is some part of the order, and they're behind that. If we need to update the guidance, we will do that, and we'll continue to do that. This is changing on a daily basis. We've increased the guidance along the way, and it seems like we need some clarity around these issues, because if people aren't practicing the physical distance, if they aren't using protective measures that are non-surgical, then they're out of compliance.
As far as those who work at some of these salons, is there concern for their health? They can't, if they don't go into work, they lose their job. If they go into work, they're concerned that they're not keeping the recommended social distancing.
Well, I've got concern for workers in any business in the state of Arizona, and I want to separate out essential businesses from critical businesses. Those are the doctors and nurses and first responders. They're stepping up. But we do hear that there's some fear of people that are working in the marketplace, and there's all the rights that they had before the emergency declaration. They still have those rights. There's also a social safety net. I imagine we're going to get to the economy at some point, because we are encouraging people to stay home, stay healthy, and stay connected. If people want to follow that, they can take advantage of what's going to be provided not only through the CARES Act and the federal government, but the state as well.
So you're comfortable having these folks working their jobs to where, again, the CDC recommended social distancing isn't happening?
I want people to follow the social distancing. That's what I've been talking about. That's why we shut so much of the state down. And basically, this is what's happening right now. 40% of the working people in the state are feeling this because their business is either shut down or they've been sent home.
I want to ask you another viewer question. This is from Hester Van Heemstra in Tucson. And Hester asks, although social distancing and stay-at-home recommendations have been put in place, why have these not been mandated with penalties for going against these?
I want to address this because I think this is some misinformation. I presented this as stay at home, stay healthy, and stay connected. I didn't use the words shelter in place because I believe that Arizonans are smart and they're responsible, and that's certainly what I've been observing. I gave the order on March 30th, and it's a directive enforceable by law. The order went into effect at 5 p.m. on March 31st. I worked a little bit later that night, but still left in rush hour time. I drove home on empty streets and an empty freeway to my home. No one was out. That evening, I took the garbage out about 9 o'clock, and I live on a very busy thoroughfare. The only night that it's as quiet as it was on the first night of the order is Christmas Eve. People are listening to the order, and that will help slow the spread. But if someone's not listening to the order, law enforcement can suggest that they begin listening to the order. And if they don't, they're going to have a Class 1 misdemeanor, which is a $2,500 fine and up to 6 months in jail. And we will enforce that. So it is enforceable. There is teeth. But right now, where we are in terms of the preparation that we need for what's coming our way, in terms of the other things that need to happen in state government and delivering those products to the people that need it in our hospitals and around our state, we're making that happen.
Governor, in the order you also prohibited municipalities, cities, towns from enacting their own mandates and ordinances if they wanted to close nail salons and hair shops.
No, that wasn't the reason.
Well, no, I'm not saying that's the reason. I'm just using that as an example. Why should not mayors who are close to their people and close to their residents and citizens, why should they not have the ability to go ahead and enact things that they think will keep their citizens safe?
We wanted to bring clarity to the order. We wanted the state to be able to speak with one voice for what was necessary and responsible for Arizonans. I was being asked by not only business owners but other members of the community that there was a lot of confusion. Oftentimes, you don't really know if you're in Tempe or Mesa, Gilbert or Chandler, Phoenix or Scottsdale. And when we had different mayors giving different orders, we wanted to give one directive so the state could speak with one voice. Now, we can elevate guidance by areas in the state, but that would most likely, if necessary, be by county. If you think of Maricopa County versus Yavapai County, two distinctly different areas. We've got, I think, 91 municipalities in our state. We're not going to have different guidance for all 91.
So would you be willing to go on and put a shelter-in-place order if you find that people are, in fact, not listening? That's a lot of the question we've been getting, is that, yes, most people are very good, responsible people who want to do the right thing, but it's not the same for everyone in terms of what they think needs to happen right now.
Very fair question, Carrie. And in a declaration of an emergency, there are an incredible amount of tools and authorities that are granted a governor. And I will use every tool in the toolbox and escalate as necessary to navigate Arizona through this. And I've probably done that once or twice a week since we declared the emergency.
Are you considering perhaps checkpoints at Arizona borders?
We've got a list of things that are possible, and if necessary, we will put them in place. Now, in terms of our southern border, it's basically been shut down to tourists and visitors. It remains open for trade. There's a lot of good communication between governors and how we handle those types of situations. And where we are in Arizona right now is on top of where we should be, and we're monitoring the situation and the numbers to make sure this next month, April, is going to be a tough month, April and May.
Can you keep it from being so tough if you perhaps quarantine those folks who arrive into the state from hotspots around the country, around the world?
We're doing the testing so that we have the proper surveillance and can make decisions so we can get people the care that they need inside the healthcare system. In terms of quarantining, anyone who's sick should be staying home. Anyone who has symptoms should be staying home. And anyone that violates those types of directions, well, yes, there's escalated authority that the governor has that we can work with law enforcement so that they won't be.
Would you recommend that, Dr. Chris, that people who come from New York or New Orleans or other hotspots, Detroit, parts of Michigan, that when they arrive into Arizona, that they self-quarantine?
So that's this current CDC guidance, is to, if you have been from one of those areas or you've been in contact with an individual who is COVID positive, that you should self-quarantine. You should, but as far as making sure that happens, that's not in place as yet.
It's in place whenever we put it in place, whenever we have someone violating it.
Governor, let me ask you, we received some questions from a group of doctors, and one of those questions was, does the governor have the power to shut down airports in Arizona?
The governor has the authorities to do what is necessary for the protection of the people in Arizona. One of the reasons I didn't use the word shelter in place versus please stay at home, they both have the same goal. It's to increase the social distancing. Shelter in place is often used if there's a potential nuclear attack or if there's an active shooter. So before we start talking about shutting down the airport, we should talk about the situation that we have now and what we're preparing for. Because those are the maximum, most extreme authorities. And like I said, I would use every tool in a governor's toolbox to protect the people of Arizona at the appropriate time.
Your message, Governor, to the undocumented community?
Listen, wash your hands. If you're sick, stay at home. Cover your cough and physically distance. We're focused on public health right now in the state of Arizona. We're doing our best to communicate so that everyone will understand that. This is a disease and a virus that knows no border. It knows no class or background or distinction. So we're focused on protecting everyone who is in the state of Arizona today.
So for those who might be afraid to go to work, who might be afraid to seek health care because they are undocumented, you're telling them
I'm telling them if they are, just what I said, Ted.
Okay.
I think that those are the right things to do for anyone that wants to avoid contracting this disease. It doesn't matter where you're from, who you are, or what your background is. There's a lot that's been changing. That hasn't changed since day one. Those are the ways to avoid and prevent this disease and to lower the spread.
What other cities and states are you looking at? Because you listen to Governor Cuomo giving his briefings every morning, and he said they're still climbing the mountain. They have not even hit the top yet. And they're obviously dealing with an absolute disaster there. Michigan has exploded over the past 10 days. I think just 2 weeks ago they had maybe 15 reported cases, and now they're setting up emergency hospitals for 1,200 or more people. They're seeking out ventilators. Which states are you looking at when you look at the weeks and potentially months ahead?
Well, I want to say that I'm looking at every state, and I've got a relationship with every governor, and governors are very collegial. Governors do these conference calls under what's called the National Governors Association. All of us have been on the video conference calls with the President of the United States and the Vice President and the top medical team from the federal government, Director Christ and General McGuire on those calls as well. So because others have been hit before us and have been hit harder, we have been able to plan and prepare and I believe be ahead in a position so that as this grows in the state of Arizona, we will be able to care for the people that need it. So we're talking with all those. Of course, New York has been the example of, because they were hit first, they're in a different situation. And we're seeing how they're handling that. What's going on in Louisiana right now is an incredible outbreak. Many believe it was because of Mardi Gras. We're seeing things in Detroit. Of course, California had the hot spots up in San Francisco and Northern California. So those are all things we're monitoring and learning from and allowing us to acquire PPE. Of course, we're going to help out wherever we can help out, but we're preparing for what's going to happen in Arizona.
Do we have enough hospital beds right now for what is forecast in the next couple of months?
Today, on the forecast that we're working on, and Ted, this is how you do it in a pandemic. You plan for an absolute worst case scenario. That's the only thing that's prudent. So where we are in Arizona today, we have enough hospital beds. As this grows, we may need more hospital beds. That's why the Army Corps of Engineers is here, and they can build field hospitals. We're planning, if necessary, if needed, 2 additional field hospitals for Maricopa County, 1 additional field hospital for Pima County. We also have a lot of different options on how we could care for people that were in this situation. All of our hotels are basically closed with 0 occupancy. All of our college dorms are in the same position. We have some recent hospitals like St. Luke's that recently closed. We're going to have enough beds and enough rooms. What's going on in New York and New Jersey and Louisiana is not what's happening here, so we're able to plan ahead.
Do we have enough ventilators? Do we have enough respirators?
It's ventilators that you want to focus on, and we need to acquire ventilators. Today we have 1,500 ventilators. We have an order in for 5,000 more, and based on some of the modeling, I'm going to let the subject matter expert talk about how we close the gap and the different options that we have to close the gap with things that can serve as ventilators.
Dr. Chris, are we getting our fair share of these respirators and ventilators?
So we continue to work with the federal government. Based on the numbers that we have run, it looks like we will have enough ventilators if we are able to procure them from the federal government. We've also just issued a grant so that hospitals can purchase more ventilators. And then we're working with our surgical, like our outpatient surgical centers, to see if anesthesia machines can be converted so that they can serve as ventilators as well. So we are looking at all options.
And another thing that we've learned from New York is they're converting sleep apnea machines. This is not an ideal conversion of ventilators, but there's a lot of ways you can do if you were in a crisis type situation, which today Arizona is not in terms of the number of contractions and inside our hospital beds. Just know that all these options exist.
ICU units?
Yes.
Doctor?
So that is one of the things that my team is focused on. So we are working with all of our hospitals statewide to identify the ICU rooms. And then that's one of the things that we're looking at St. Luke's for, because that could bring on 300 additional ICU beds.
And real quickly, I had a doctor ask me specifically to ask you, morgue space, do we have it?
So we are looking at how much more capability we have. We likely would need to bring in additional resources for that.
Governor, I'd like to ask you just at a very human level. I mean, you're a father. You're watching this happen in other states. What is your level of concern about how fast this is spreading? It is in all of the counties, and it is spreading fast. What is your reaction and what is your honest level of concern as we sit here right now?
Well, I want to say I have a high level of concern because I see what's happened around the world. I see what's happened in other countries. I see how early New York State was hit. And we've been working incredibly hard. I'm talking about how tough the next month is going to be and possibly May. This last month was very difficult. But because we were able to see what was happening elsewhere, because the first case in Arizona was on January 26th, and we stood up the Emergency Operations Center on January 27th. We declared our state of emergency on March 11th. We closed the schools. We put an executive order that kept people outside of our retirement homes. If you remember in Seattle, they were also hit early. And what happened is in the retirement homes, the spread began there. I put the executive order that they could shut down the retirement homes so there would be no more visitors. And you asked about how do I personally feel about it. My grandmother is 96 years old, and she's in a retirement home in Arizona. My mother called me up and said, they won't let me in to see Gammy. Can you do something about it? And I said, Mom, they're doing exactly what they're supposed to be doing. So I think different people had a concern about what can happen with this virus at different times. We have been vigilant from day one to make sure we're doing everything we can to slow that spread, to allow this to not hit our most vulnerable, and to make sure that we can care for those that contract it.
I want to just get a quick follow-up there. Another viewer question from Rich and Debbie in Phoenix asking for a specific answer here. If the number of COVID-19 cases continues to rise in Arizona, even with your stay-at-home order in place, what specifically will your next step be?
Well, that's why we plan every day about what we're going to do in this healthcare crisis. I believe right now, in terms of increasing escalation that would be possible, would depend on the situation. But we will do that. We will act. We have acted the entire time. You've seen the amount of businesses that we've been able to shut down, how we've been able to restrict access, and we'll continue to do that. And that's, this is my number 1, 2, and 3 priority, is all about the public health side of this. But there's also the considerations about what's happening inside our schools, what's happening inside our economy, what's going to happen as we get through this. And I do believe we're going to get through this. That's why I'm talking about April and May right now. But the idea of these escalations before they're necessary are not things that would be appropriate to where we are today.
Governor, you talk about the actions, and they have been noted. The criticism is that the actions were reactionary as opposed to looking ahead. How do you respond?
I'm looking at Arizona. I'm looking at the facts in Arizona. I'm not in competition with any other governor in the country. I'm here to make the best decisions with the information to protect Arizonans, given where we are in real time. I've been 100% focused on our state and those decisions, and I'm confident with the guidance of Kara Christ and the Centers for Disease Control. We've been in alignment the entire time, and we've been right where we should be along the way.
I have a question about wearing masks. So we've heard the mayor of Los Angeles has now asked people to wear masks, not the surgical grade mask, but just something to cover your face.
I want to address this. If the Centers for Disease Control says to wear masks, you should wear masks. If there's federal guidance to wear masks. We'll put that directive out there. Right now, these masks should be reserved for the doctors and the nurses and the medical first responders on the front line. There's a shortage of masks. There's a shortage of so much of this. This is why we've accumulated from the Strategic National Stockpile. This is why Dr. and Chris and I are opening up boxes on Saturday morning for who may need these masks into the future. And today we're in a good position. So that's why I've stayed in the guidance of the CDC and not guessed on what directives I should put forward.
I just want to follow up on that, and we will turn to the economy in just a moment. But if I could ask, and this is not talking about the N95 mask, and I'm looking at my phone here because I am getting some comments here currently, and this is someone telling me that there was a conference call with healthcare CEOs about tonight's show, and they wanted to encourage the public to cover their faces when they are out in public, specifying they're not talking about the N95 mask. We've heard in recent days that the theory about this virus has changed, and now there are potentially viral droplets. So if I'm just speaking to you rather than coughing or sneezing, I'm at risk. Can you go ahead and speak to that?
So this is something that the CDC is looking at just over the last day or two. They have provided data that shows people may be spreading the virus up to 2 days before they develop symptoms. So I know that they're reviewing the current guidance with masks. There's pros and cons for both. So if you wear the mask, you might be able to prevent speaking or sneezing or coughing, but it also puts you at risk when you're touching your face and bringing it down and potentially having that false sense of security. So we continue to monitor to see what our colleagues at the CDC says, and we'll make that guidance if they change that.
Carrie mentioned the economy. Let's get to that here real quickly. The applications for unemployment, the numbers are absolutely staggering, and it's going to be tough for quite a while. Basic facts here. Who qualifies for unemployment in Arizona?
So we have a website, ArizonaTogether.org, that I want to ask everyone to go to. It's not only a place where we've been collecting donations, and I want to thank Michael Bidwell and the Arizona Cardinals for leading it off with $1 million. It's also got all the information. Now let me give the overview on this. The federal government has stepped up with the CARES package. That's a $2 trillion package. There are hundreds of thousands of Arizonans that have been displaced. These are great, hardworking people. Many have never asked for anything from the government, and today they have no income. They have high anxiety. They're concerned that they could lose their apartment or their home. With the CARES Act, along with what we have in state government, we have a lifeline so that they will be able to have dollars through unemployment. And the way we read it, my concern is for everyday Arizonans who have been living paycheck to paycheck. That's who I prioritize first. And then I'm thinking of small business people and medium business people. It seems that the big guys always do okay through the downturn. But all the information for those programs, and these dollars have really been plushed up. You're talking about with the state unemployment, somebody who's going to be able to receive $840 a week over the course of this. They won't lose their apartment. They're not going to lose their home. Now, the challenge is going to be getting these dollars out, both at the federal level to the state, and then I know you're going to ask at some point about the website at the Department of Economic Security. Unemployment hasn't been something we've been dealing with very much in the last several years because we've been booming. All of a sudden, the economy falls off a cliff, and it goes from a couple thousand hits a day to a couple million hits. We've brought in reserve servers. We'll be able to get these issues processed, and it's part of the reason that I brought Daniel Ruiz here. He's our Chief Operating Officer, and he's making certain that we coordinate across state government, so not only does public health lead in terms of what our concern is, that we're taking care of people and that they don't fall through the cracks.
Before we get to Mr. Ruiz, real quickly, should the state, you mentioned $840, $600 of that is federal CARE Act. Is it time for the state to step up as far as unemployment benefits?
Well, the state is stepping up. The state is already giving dollars to homeless shelters, to food banks. The idea here is we want to make sure that people don't fall through the safety net, fall through the cracks. You know, Ted, we're in a position when we started the year, we had $1 billion surplus in our general fund. We have $1 billion balance in our rainy day fund. We're in a position right now where there's been no disruption to our teachers and our school workers. So we're going to make the right decisions once we have the entire package and a clear line of sight to make sure that nobody falls through the cracks here.
Real quickly, Mr. Ruiz, as far as someone watching right now, they've lost their job. They need unemployment benefits and they need them quick. What can you tell them?
Sure. So we know that now more than ever, the services the government provides is critical. And so we've built additional capacity on the AZDES website. We've added 100 call service workers. They are taking phone calls. We've built capacity there. There are multiple ways that many people can apply for unemployment benefits. Go to ArizonaTogether.org for additional guidance. We are working around the clock, investing in server capacity, hiring workers to answer calls. We want to get these processed as quickly as possible. We know that now more than ever, the continuity of the services that government provides are vital.
Small businesses?
Small businesses can go to our website, ArizonaTogether.org. There we have resources from the Arizona Commerce Authority as well as the Small Business Administration from a federal government perspective, where we can provide options in terms of financial relief and payment assistance.
I want to go to another viewer question. Alethea Lass from Yuma. She asks, is there a mandatory non-essential business closure order or not? If we own a non-essential small business, is it mandatory to close or is it a choice?
We need them to socially distance. What they want to do, a lot of our businesses have already closed, either because there's no business or because the owner decided to do it or because people aren't coming to work. But we're giving them the option as long as they follow the guidance of the stay home, stay healthy, stay connected order.
I want to ask you another question from a viewer, and this goes to do...
Carrie, I want to follow up on that. The objective here was to protect public health, to make the right decisions so that we get through this pandemic. It wasn't to shut down everybody in the state. It wasn't to shut down the great outdoors. We're seeing much of this is already happening. Those are the unemployment claims that we have. But we want to give additional guidance so that there's clarity there.
We have a question here from one of the radio listeners saying that that their employers do not have social distancing guidance in place, and they are not giving folks an option to stay home when they are sick or think they might be sick. So what do you say directly to those businesses?
If somebody's not going to enforce social distancing and that worker I'm glad that they're thinking this way. They're going to have the benefits. This is why they can go to ArizonaTogether.org and they can access the benefits and they don't have to be there any longer.
But what do you say to the employees?
I say they don't have to be there anymore. They can access the package that has been distributed from the federal government. What I would say to the employers is if law enforcement sees that people are gathering in large groups and not enforcing social distancing, they're going to be the ones that are cited.
We talked about economic issues here as far as renters and those having to make a mortgage payment and no can do right now. What's your message?
Well, if you can't make your mortgage, if you can't pay your rent, you are not going to be evicted. I've put an executive order out there so that these proceedings are not going to take place. Now, it is about 40% of our working folks that have been affected by this. They've either lost their jobs or they've had their pay lowered. If you haven't, if you are gainfully employed, if you're in the same situation that you were before this outbreak happened, we expect you to pay your rent. But we're going to work with everyone through this situation, which I think we'll be able to navigate through over the course of time so that nobody falls through the cracks. That's the top priority, while making sure that we also manage the public health part of it as proactively as possible.
A moratorium on evictions. I think one viewer suggested perhaps a mortgage and rent freeze for 60 to 90 days. Does that make sense?
We're making certain that no one is evicted. We sat down with the landlords and the banks. Ted, this isn't the kind of market where anybody's raising rents.
I wanted to, if you could talk specifically to one viewer who asked, how does the state's delay of evictions actually work? Do you have to show proof?
No, you do not have to show proof. The executive order is protective for 120 days for anyone that's in this situation.
And real quickly, I didn't mention freeze on the number, freeze on the requirement to pay for 60 to 90 days.
It depends on your situation. If you can't pay, you're not going to lose your apartment or your home. If you can, you should keep up.
So you talked about if people are not social distancing, and if you have to get tougher, we have a member from the National Guard here. Would you use the National Guard for enforcement? And then, sir, I'd love to have you speak to that.
Well, first I want to say that the National Guard is doing incredible things. They shored up the supply chain inside our grocery stores that have been so depleted. Just recently, they took Black Hawk helicopters up the Navajo Nation to deal with the outbreak that happened there. And that is not the role of the National Guard unless there is a riot or social unrest. These are issues our law enforcement people are more than capable of handling.
And Major General Michael McGuire, can you just speak to sort of what your role is right now and how you guys are reacting to this crisis in Arizona?
So our role in the Department of Emergency and Military Affairs is to be in support of all of the incident commanders. In this particular incident, as it pertains to the coronavirus outbreak, the incident commanders are in all 15 counties. Our hospital incident command teams, our county emergency management, and we take our lead from Dr. Christ about public health and policy issues as we execute to support and manage crisis. As the governor mentioned, one of the very first things that the governor asked us to do in the Guard was help secure the idea that all 7 million Arizonans would have food, ice, water, and medical supplies. And the most critical part of that is sustaining the food supply and the logistics, that final mile logistics that we do. In Arizona, in the National Guard, there are 8,200 members of the organization. Those soldiers and airmen are part of all 15 counties. They serve as our neighbors, members of our churches and schools, in our local businesses, and when called to duty under the direction of our Commander-in-Chief, Governor Ducey, we take our lead from him about what missions are assigned. So the logistics mission was the priority. As the governor mentioned, there was some emergent issues that occurred over the weekend on the Navajo Nation in both Tuba City and Kayenta and Chinle. We're working diligently with tribal leadership to try to allay those emergent issues and provide a more enduring solution.
Governor, the decision to close schools earlier this week for the rest of the academic year, why then?
Because the guidance from the Centers for Disease Control was that we should continue to socially distance through April 30th. Typically, the school year goes through mid-May. We wanted to give clarity to parents. We also wanted our teachers to know what they've become so skilled at. This idea of distance learning is how we're going to complete the remainder of the school year. And I want to say thank you to Superintendent of Public Instruction, Kathy Hoffman. She's been a partner and a leader, and we've been able to be shoulder to shoulder in alignment in communicating to parents and teachers and public schools across the state in this time.
For students, for families worried, high school seniors right now worried, are they going to graduate? For people who have kids in the 3rd or 4th grade, are they going to make the 4th or 5th grade? What are you telling them?
Your child is going to graduate. Your child is going to be promoted. We're going to have some work to do. Now, our kids are working right now. Where they can, they are distance learning. The teachers are coming up with great ideas. There's this closed, not closed hashtag that they've been doing as they begin the day and go through the classes and curriculums. But this did come out of nowhere. There will be some work that needs to be made up, but we're not going to penalize or be punitive to any of our children or our parents as we provide the flexibilities and make sure that they have the essentials that they'll need to know as they complete their grade school career.
Some of those essentials include the ability to learn from a distance, and a lot of children in Arizona simply don't have that technological capability. What's being done about that?
Well, there's been a lot of people in the private sector and philanthropies that have stepped up and provided tools and dollars. And you can only imagine when you go from learning every day and coming in to hear the bell at 8:05 to all of a sudden you're at home and you're doing this distance learning. So we want to have an equal platform across the state for our students. There will be some that didn't have that, but like I said, we'll have to come back and make up for it.
And one more question on this. Are you, Superintendent Hoffman, are you preparing for the next school year?
Yes, we are preparing for the next school year. We want to get through this school year. There's so many questions around what's happening in grade school, what's happening with high school graduations and college graduations and the conference of degrees. And of course, we're thinking about what next year can look like. The first priority, though, is on public health. The better we manage this and put this behind us in a way where we can get back out in some semblance of normal, we'll have a better idea.
And just a moment ago, we had on the screen another viewer question from Marlette Mason. I think this is a really important question. A lot of people have asked about this. What about the kids that don't have internet service or laptops or iPads to do schoolwork? My kid's education is important to me. I'm a single mom. I can't afford these things. Can't get a hold of school or school district for assistance. What do I do?
So we sat down with the providers, just like no one's going to lose their home or their apartment. We sat down with all the major internet providers, and part of this year's budget was to go to rural Arizona and make sure all of Arizona was connected. They're waiving fees, they're upping the power, so anybody that has access to this type of thing, which is pretty much anywhere in the urban core and other parts of our state, and we want rural Arizona to be a part of it, and so many of the places around our schools can do that. But it's not ideal. We have work to do to fix that. This is something we didn't see coming.
And what about providing food for low-income families? And a lot of those kids rely on the food from the school day.
We've increased the benefits that we're providing at the state level. The federal government has worked with us, so people don't have to wait the time to qualify. All that's been waived. Not only do they have access to the SNAP benefits, they have access with approval. We're working with our federal partners on this to hot food as well. I've been with Superintendent Hoffman at some of the schools. We still have the food supply now that the supply chain has been connected, where we're passing out lunches and breakfasts at our schools around the state.
And real quickly, special education students, the resources in schools, that's very important to those folks.
This has been very tough.
Yeah,
this has been very difficult on our special education students. We're going to have some work to come make this up, and we're going to address that, and we acknowledge that. And all of us are challenged by what's happening here. No one more than the parents of our special education students.
And I did want to get one other viewer question in here, and this is a bit of a tough one, but you're here for transparency. Aaron Jade Helm asked, please ask the governor why it took school superintendents drafting a letter with 52 signatures and closing districts on their own before the state super made the call, and why it took mayors across the state sending a similar letter to the governor before he issued a stay-at-home order.
Well, the first thing I want to say is we have been able to handle the unfolding events in this crisis in a way that keeps the state together, that stays ahead of the curve. Of course, we would love if it was possible in a safe way to have our kids inside a classroom and learning. In this situation, that's not the case. I need to work with other leaders in education, and thank goodness for Superintendent Hoffman, where we've been able to make these announcements in concert and in time so parents have had clarity.
Governor, we're running out of time here, so the state is watching, and the state is afraid. People are afraid. They're frightened. They're concerned. They're confused. What are you telling them? I mean, just a straight message. What are you saying to people that are watching right now and they're at wit's end?
I'm saying to people that we are going to over-communicate. When I know something, you're going to know something. We're going to get the facts out there, and I understand some of the confusion. This has been so rapidly changing. We see what's happening in parts of the world and parts of the country, and as we know more and have more information, we've changed and we've acted on that, and we'll continue to do that. This is going to continue to be a situation that we need to deal with in a fluid way so that we take care of all Arizonans, and we're going to continue to be out there answering the tough questions and over-communicating, and I'm very confident that I have the best people around me that are working on this 24/7, and it's their top priority.
And you have a lot of intel that you're getting every day. How long do you believe, honestly, that this is going to last? Governor Cuomo said today that New Yorkers should be expecting well into August.
Well, I don't want to make any predictions on where we are. Anybody who's telling you that they know when this is guessing, and they don't know. What I do know is what our plan is going to be for April and May, and we are going to be prepared for anything beyond that. But right now, I'm looking out 60 days. That's what we're going to be prepared for. I'm confident that we'll be able to do anything beyond that, but that's where Dr. Kara Chris said not only are we going to have our surge in illnesses, but also hospitalizations. And if we can get through that, I think we need to reassess come May 1st.
All right, Governor, General, Doctor, Mr. Ruiz, good to have you all here. Thank you so much for joining us, and thank you for answering our questions and our viewers and listener questions as well. Thank you. And don't forget all of the state resources available to you online, where you can get real-time updates on the state of Arizona and COVID-19.
We also want to make sure that you know that 80 radio and TV stations around Arizona committed to broadcasting this town hall. They want the same answers you do. So you should continue to lean on your local media and let them know what's on your mind as we navigate this unprecedented crisis together.
And again, thank you to all who participated tonight. We appreciate your time and we appreciate your responses. Thank you, Gary Pena. Nice working with you. And thank you for watching. Stay healthy, stay informed, stay solution focused. Have a good evening.